Hello everybody, welcome back. Today I want to talk to you a little bit about my clinical setup and what types of tools and little things that I use in my basic setup, and even maybe some of my favorite little things that I use in the operatory every day. If you'd like to hear more about that, then let's get started. So the very first thing that we do, of course, since the pandemic, is to wear a different kind of dress. I mean, I was always wearing, you know, a team shirt and a blazer and things like that, and I'll still wear that sometimes for clinical exams. But if I'm in the clinical situation where we're using, you know, water, air, we're working on the patient to any capacity, then we'll use these drapes. And we had these custom made by our patient, and we're very happy because I wanted something that matched. Can you imagine that? Anyway, and then we had these little smocks made, and of course we wear, I don't have everything on today because you wouldn't be able to see what I'm saying, but the next thing that I could never do anything without would be my clinical loops. So these have a light on them here, and this light has an orange option and it has a white option, and the white gives me just like pure light. So if I'm doing something that isn't involving, you know, curing filling material, then I will use the straight bright light. But if I'm curing, if I'm doing a white filling material, then it can set prematurely before I get it sculpted. So I'll use the orange option, and that allows me to then have more working time. And so many dentists love that. And of course, there's always magnification, comfort. I don't have any wires on my loops, so they give me powerful light for about 4 or 5 hours. And this one that I use is oroscoptic. I've been using oroscoptic for years. So those are the things that I have to just kind of the basic dress up that I have to do. The next thing, of course, is, I'm gonna say this because I've been using, like, of course, every dentist has a mirror, right? So this is the mirror that most dentists were trained to use in dental school. It's just a basic mirror, stainless steel mirror, and it can come apart, and when you get, you know, the mirror gets scratched, you don't throw out the whole handle, you just sort of reattach a new mirror because they do get scratched. But recently I had a colleague come visit, and he was noticing that I was using these mirrors. He's like, oh my gosh, you don't know about these mirrors? They're called Zerk. And if anybody, I mean, this is not a promotion for Zerk, but I have to tell you, this little mirror has saved my life. I can't imagine now. I love it. It's almost like a, it doesn't fog up, and it keeps, like, it's a very good mirror. So high quality and doesn't fog up, because you imagine every time you breathe, my patient breathes, then I have to like clean my mirror and defog it. So yeah, so that's my mirrors now. These are also a little bit lighter. So we use these, and they've been working really well. And the other thing that is my very most basic, I remember the day in dental school when I learned that I would be using this tool, and it's called an Explorer. And it's kind of cool that it's called an Explorer because it allows you to detect hard tissue problems with the sharp end, and it allows you to detect soft tissue problems with the other end. It's got a little measuring tool on it right here as well, and that allows me to measure like the health of the gum tissue, whether or not it, you know, is swollen, whether or not it's going to bleed, without really poking it. So it's a very dull tip, but on the other end it's a little bit sharper. Now we're really careful to not like dig into a tooth because we can actually cause a cavitation, make it worse. But we're really cool, like we kind of gradually like run it across the tip of the enamel, and it really allows us to find any little catches and things like that that might be between a filling in a tooth or just in a tooth itself. So my mirror and my Explorer, have to say, and my loops, 3, you know, very crucial tools, right? And those are always on my setup. In fact, my assistant now, she will give me 2 mirrors because there's a really good chance I'll drop a mirror, or I will just mess a mirror up or lose it. You know, these things happen, right? So yeah, so I always get 2 mirrors and my Explorer. As a slow dentistry clinic, we want to always make sure we're giving our patients the most safest dental care that is possible. And one of the tenets of that is to use a rubber dam. Now, rubber dam, I always get people always say, oh, the dam, or they'll say, oh, the rubber dam. You know, they really don't like it, but there's some things that we can do with the rubber dam that can actually make the experience better. And so I'm going to show you what those are. So if anybody, just so I can back up for a second, the rubber dam is this piece of rubber. It's a non-latex rubber. The holes are punched to accommodate exactly where we're working, and then there's a little ring right here that actually squeezes around the back tooth, and it'll feel like some pressure, but it just does that to help hold everything on. And then we kind of poke your teeth through these little holes you see here, okay? Like that. So once that's on, sometimes I find patients are just like, you know, I just find it so hard to stay open. So I have these handy little what we call bite blocks. So they come in different sizes, and these are a lifesaver for, especially for pediatric patients. I always want to have a little bite block in there because A, I don't want to get my fingers bitten, but little kids, they can't keep their jaw open. And that comes with adults as well. If it's a long procedure, it's really tiring, the jaw muscles will get really tired. And so we always do that. And I honestly rarely had a patient say that they didn't like it. They generally feel like a rest, and they feel it's almost as if you were tired and you got to rest your shoulder or your elbow on something. You kind of just rest it down. So it gives my patients a lot more comfort. And yes, it's one more thing in your mouth, but it's really a lot better than just trying to stay open for that whole time. Now, another thing that we'll do is we'll actually cut a hole in the rubber dam over here, like somewhere else where we're not working. So if the patient really does feel claustrophobic and needs to breathe through their mouth, they can do that a little bit more easily than if we don't do that. But we'll try to do these things and, you know, work as efficiently as we can. We don't leave our patients like sitting very long with the rubber dam, just waiting there, getting nothing done. If we put the rubber dam on, we are ready to go. So anyway, I just want to kind of go over that because it's a really cool way to protect ourselves as healthcare professionals from the patient's aerosols and things that are coming from the mouth. It could be coming from the, especially now since the pandemic, we're much more concerned with airway aerosols and things like that. So it really helps protect me and my team, and it helps protect the patient too. You know, sometimes we drop things, there can be things that can happen, and so we really don't want that going down your throat. And so it's a two-way protection, so it's great. Yeah. Now, my assistant always says, she says that, Peggy, you should have been a fireman. Like, you should have been a firewoman. Should have been, with the fire department, because you can spray water endlessly. I love spraying lots of water, and that's where the rubber dam comes in too. But we'll use a lot of things to clean the teeth, but we also want to just wash the teeth with water. And what we'll do is, with my air water tip, we have a few buttons here. I can actually spray directly just water. I don't know if this is gonna spray. Or we can spray water and air. Oh, that made me look all dewy. Anyway, I just wanted to show you, because what I like to do is I like to prepare the patient. So if I'm gonna be spraying water, I need to give you like a heads up. So I do use both things, and of course our water syringes use water that is bottled water, and we are very careful about what kind of water we use in our clinic. Another thing that I love though is what's called sonic fill. Now this I can show you, it's connected to my thing here, and the little tip, the little cartridge or anesthetic is in here, and it basically creates like a flowable material through like an ultrasonic vibration, and it basically injects in a very smooth way composite resin into the tooth, and then as it hardens, it actually turns into something that's even harder than our regular composite that we would use. So this is really good when we're in we don't want to take too long to be filling teeth. We'll really inject quickly for pediatric patients. If we're building a core in the tooth, we can do a lot of great things with it. It's not my everyday composite resin, but I honestly I wouldn't want to do dentistry daily without my sonic fill. And I think Kerr makes this, so it's a really great product for certain applications. What else do I love? Well, I love photography. Anybody who knows anything about me knows that I love to document. And one of the things I love to document is teeth. And I don't always want to see the lower teeth in the photo. So I'm going to demonstrate this for you right now. And so this is the paddle, and these are awesome because you can really, especially if you're doing aesthetic cases, you want to have some of these. If you as a patient experience this, it's because we're trying to really just highlight the upper teeth. So we put it in the patient's mouth like this. And what it does is it takes away all the background noise. So the background noise, if I just showed you a picture of me, like that, then my tongue would be in the picture, my lower teeth, and that's just not so pretty. So pretty pictures, love that, especially if you do any posting on Instagram or for any, you know, lectures and things like that. So I always get my patients to have a picture taken with the black background because it really it makes the teeth pop, and it really shows off the translucencies and the colors and things like that of the teeth. Another thing that I love, I don't know if any dentists know about this, but it is something that has been used by, you know, by Dr. Christian Coachman. I think they actually developed some of these products is using a pink composite resin. So let's say there's some gum tissue missing. I don't have it actually. The one that I want to show you is not right here right now. We can show you this one now. No, it's not. That's not the one. But anyway, the point is that you can get pink flowable. So if you look at this type of composite resin, when I squirt it out, it's like really white, right? Like we want white filling material, right? Okay, so we want white filling material, but what if there was some gum tissue that we wanted to like simulate up in an area by the gum line? Well, we can actually get that type of material now. We can actually simulate where gum tissue would be. There's certain applications, of course, I'd use that for. I'm not going to get into it in this video, but once we have it, so this is like any resin, we need to use a special light. Now, if women have ever gone to the salon and gotten their nails done and any kind of curing, we use curing lights. So you can see here, this is a special light, and right now the material is very soft still, so you can see. I don't know if you can see that. It's super cool. Like if you like to play with gooey things, then dentistry is your field. So we've got that, but let's say we want to make that hard. We're gonna put the light on it, and give me one more second, and voila. It's any shape you want. Like this is so cool because we can make teeth a shape, and whatever shape I sculpted, then I will put this special light on it, right? And it stays hard. So now we've got, again, no one's tooth is gonna be this shape, but I have a shape that I can use for my tooth that is tooth colored and whatnot. And I can do the same thing with gums as well. One of the last things I want to talk about is the difference between the dental drills. Especially when we have children in the chair, we always want to explain to them before we start, you know, what type of sounds and types of things, but I also tell adults too, always preparing them. Like that's one of the things we do as a sensory-friendly clinic. We are trying to prepare our patients for the sensations or the sounds. And so when you look at different drills, I'm going to pull them both off here. These are both dental drills, okay? You see these two drills? And they're very different, okay? So the one on the right here, or the right, is what we call a high-speed dental drill, and the one on the left is a slow-speed dental drill. And the difference it makes to the patient, so ultimately you as a patient, you probably, you know, you're like, just fix my tooth, I don't know. But what it will be is that the one on the right, this one here, the skinnier one, the one that's smaller, is actually going to be less vibration, but it's going to be a lot louder. And the one on the left, the slow-speed one, is going to be a little bit less loud, less high-pitched, but it's going to be much more rumbly. So we always say, oh, it feels like a little, you know, rumble in your tooth, a lot of vibration. And people who are sensitive to vibration and things like that certainly may have more problems with that. So I'm really careful. And one of the other things I really notice as from a dental perspective is that if the patient still like feels something, is starting to feel something, they will generally always feel it if I'm using this high-speed one. But if I'm doing the slow-speed dental drill, they'll actually have no pain. So for very like simple things, sometimes I can just clean the tooth with the slow speed and I don't need to give as much anesthetic, or the patients just won't have as much pain. So for whatever reason that is, I just find it really interesting, and I always try to make sure I manage my patients, you know, pain, comfort, expectations, what are they experiencing? All the time I'm explaining as I go. Anyway, that's pretty much it. I just wanted to share that with you. I hope you found that interesting. If you want to give me any feedback, I would love to hear your comments, or if there's any other types of topics you would like me to explore, I would be happy to do that. And so until next time, I wish you all a great day, and I will see you next week. How was that?
That was really cool.
Was it?
Yeah, it looked really cool.
That's awesome.